To turn on the Z3, press the power button. The boot up process takes but a few seconds. A brief conversation with the patient will enable you to set up the machine correctly. You can choose between a man, a woman, a hysterectomized woman, or a child. Using the on-screen menu, decide whether you're going to use the easy mode or the expert mode. We're going to choose the easy mode for this demonstration. Pressing return at the end of the operation takes you back to the main screen. We're going to use a phantom bladder to demonstrate the scanner in easy mode. By pressing the button once, we go into pre-scan mode. And you can see that as we move the scanner probe around, so the image on the screen changes from yellow to green. Press the button for the second time when you have the largest possible green image bisected by the vertical line. If you want to see the real-time image, you need to go into the advanced mode. Pressing the button once displays the image in real time, and you can see as you move the probe around, the image changes. Once again, you're looking for the largest possible image and bisect it with the white line before pressing the button for the second time. It is important whilst scanning that the probe is held still and the patient remains still. And by pressing the up and down arrows, you can view each of the 12 scans. You may need to print the result, in which case press the print icon on the front of the screen and the print comes out of the rear. When it's completed, just tear it off. Use the facility to include the patient's name and ID if you want to. Whilst the scanner is designed to be portable, it is easily mounted on a cradle and then onto the height adjustable stand to make it eminently suitable for use within a ward. The Avantsonic Z3. For further information, contact Win Health Medical.